Health experts are worried the political rhetoric around a vaccine could affect people's willingness to be inoculated when it finally becomes available. Our lead national correspondent, David Begnaud, is following this. David, how close are we to a vaccine?
So, Anthony, there are 3 vaccines in phase 3 of the clinical trials here in the U.S., and about 46,000 Americans are participating in them. Now, phase 3 is the final process. So determining what comes out of there, figuring out if it's effective and good data, the last step would be approval.
I think knowing that a vaccine is this close to being approved is really exciting and really promising.
37-year-old Natalie Hayden is a mother of 2 from St. Louis, Missouri. She is one of millions of Americans with an underlying health condition, which means she is at higher risk to get really sick if she develops the coronavirus. Treatments for Crohn's disease have weakened her immune system. She didn't leave home for months at the start of the pandemic. She says a vaccine would be a lifeline for her and her family.
Do you plan to get a vaccine when it's available?
I'm a little bit apprehensive about getting the vaccine, but I do think in the end I will be getting it. It is already September, so when I think about possibly having a vaccine approved by the end of the year, that seems super fast and maybe a bit rushed. I wouldn't probably take it just yet in the next few months.
Natalie is not alone in feeling that way. Americans are growing increasingly skeptical about a potential vaccine. The latest CBS News poll shows that just 21% say they'll get the vaccine as soon as one is available. That is down from 32% in July. But experts say the science behind the vaccine has been very sound.
It has gone incredibly fast, but it's been done with integrity.
That is Dr. Ashish Jha, Dean at Brown University School of Public Health. He's worried that months of hard work on vaccines could be compromised by political pressure being placed on the FDA and by campaign politics affecting people's attitudes about vaccine safety.
Our national response to this pandemic has not been stellar on so many different levels. But the one area where we've actually done a really good job is on vaccines. I want to make sure we don't fumble at the 1-yard line here. We've got to keep politics out of this.
You think that folks on both sides, whether it be the Biden camp and the Trump camp, dial it back?
I would like politicians from all sides to stay out of it, not get involved, not do political meddling, and really let the science drive the timeline.
You know, Dr. Jha was clear. He said everybody involved in the vaccine process, including the White House, has done an outstanding job on vaccines. Those are his words. Now, he says we could have a vaccine by October, maybe November or December. He's thinking later in the year, after the election. But the bottom line, Gail, is even once we pass that approval process, Dr. Jha says rolling this out to most Americans who want to get a vaccine could go well into next year, even the summer.
Yeah, but I find Dr. Jha very, very encouraging. I think he always speaks his mind. I think he speaks very fairly, but I like what he said. The vaccine has been done with integrity, and let both sides sort of dial it back. Always good to hear from him. David, good to hear from you too, wherever you are. Thank you very much.